So, hello everyone.
Bonjour tout le monde.
Interpreters, and thank you for joining us for the Cessation and Tobacco Industry Interference webinar organized by ATCA, CTCA, ATIM, STOP, and FCA. My name is Fatou Diouf. I'm the Afro Regional Coordinator and Communication Specialist for the Framework Convention Alliance for Tobacco Control, which is an alliance with nearly over 300 organizations from over 100 countries. We work on the development, ratification, and implementation of the WHO's FCTC. I'll be your moderator for today, and we will be discussing the tactics tobacco companies use to hinder tobacco cessation policies. So before starting, I will go ahead and introduce our wonderful speakers for today and how today's webinar will go. So we have Mrs. Leticia Martinez Lopez, who is the Technical Officer, Knowledge and Management, Reporting and Communications from the Secretariat of the WHO, FCTC. We have Professor Rees, who's the Director of the Center for Global Tobacco Control, Department of Social and Behavioral Science at the Harvard Chan School of Public Health. And we have Professor Judith McKay, who's the Special Advisor on WHO FCTC Article 5.3 implementation at the Global Center for Good Governance in Tobacco Control and Senior Policy Advisor to the WHO. This will be an hour webinar, so I'll do my best to keep us within this time frame. If you have any questions, feel free to write it in the Q&A box. We will answer each question at the end of each presentation. So each speaker will answer the question at the end of each presentation. So make sure to write your question in the Q&A box. For those who are writing their questions in French, it will be translated and we will answer those questions at the end of the three presentations. So let us begin with Mrs. Leticia Martinez, who will present on cessation within the WHO Framework Convention on Tobacco Control.
Thank you very much, Fatou. Hope you can hear me correctly. Yeah, I see the slides. So first of all, thank you to the moderator and thank you for the organizers to having invited the Convention Secretariat. I'm today presenting on behalf of the Secretariat and wish everyone good morning, good afternoon, good evening. Thank you for joining us. During the intervention, I'm going to introduce how the cessation is integrated and the importance of cessation in the WHO framework convention.
Please, we have challenges in hearing you. Can you use the mic properly? Please, is anyone hearing us?
It is well known by all of us, the tobacco control community, that tobacco epidemic has a huge impact, being the leading cause of preventable disease, disability, and premature death globally, killing up to 8 million people each year. This means 22,000 people seconds. Despite the work that has been done by the tobacco control community, there's still a lot to be done to eliminate this threat and revert what are the estimations on the impact on health and on the population for this century. Next slide, please. On the health side, tobacco use is a common risk factor for 4 major chronic and non-communicable diseases, which are considered the biggest causes of death at global level. And these represent over 70% of those who die in the world. And both NCDs and tobacco use are what we call the slow motion pandemics, interaction between themselves and impact on the global population. Next slide. As we know currently, we are suffering with a new pandemic, COVID-19, and on this evidence has shown that those that live with the underlying condition, mainly NCDs, they are more vulnerable to getting infected with the coronavirus and followed by a higher risk of severe disease and death among those that get hospitalized. And this is the same for tobacco smokers. So they are at risk of getting worse outcomes from this disease. And this is happening what we call as syndemic. So it's a synergistic pandemic of the three of them, COVID-19, tobacco use, and NCDs. And this increase incredibly the inequalities of most disadvantaged communities. And therefore, to address both NCDs and tobacco use must be integrated, and the response and recovery plans for COVID-19, this is what we're advocating now, and at all levels, global, national, locally, if we want to really build back better from this situation. Next slide, please. We are already in the 16th year of the adoption of an international legally binding treaty that was developed responding to this tobacco epidemic, what we call the WHO Framework Convention on Tobacco Control, or WHO CTCA. And today we have up to 182 parties. At the last conference of the parties, which is the governing body of the treaty, the global strategy to accelerate the tobacco control was adopted, and this has been developed to guide implementation of the treaty, helping both parties and other stakeholders to advance on the efforts of tobacco control work. Tobacco use has been also recognized as a development issue, and therefore under the Sustainable Development number 3, good health and well-being, we have target 3.8, which calls for strengthening the implementation of the WHO CTCA. Next slide, please. Under the FCTC, we have Article 14, which is completely dedicated to demand reduction measures concerning tobacco dependence and cessation of tobacco use. And this requires parties to develop evidence-based guidelines considering national circumstances and priorities, and promote cessation of tobacco use and adequate treatment for tobacco dependence. This article puts specific emphasis on providing cessation at specific locations, on integrating cessation in national health plans and programs, and on collaboration to facilitate tobacco dependence treatment as accessible and affordable manner as possible. Next slide. The parties to the convention adopted to guide the implementation of this article what we call the guidelines for implementation of Article 14 at the fourth session of the Conference of the Parties in 2010. And these guidelines define tobacco dependence treatment. We know they are defined differently depending on the culture and the different languages we see in the world, including from measures to reduce tobacco use in the population as a whole, but also intervention that take place at individual level. And the guidelines cover both kind of interventions. Also, the guidelines provide practical advice on how to better design cessation services. So they highlight the central role of healthcare systems and how these need to be strengthened to fulfill complying with this mandate under Article 14. The guidelines provide detailed recommendations for developing this sustainable infrastructure to support tobacco cessation, and how to motivate and help those that want to quit to do so. The guidelines also identify measures to incorporate dependence treatment in tobacco control programs existing, as well as other national infrastructure in place in the country, such as those that treat tuberculosis or HIV/AIDS patients. And it also highlights the importance of sharing experiences and best practices among parties. This help strengthening the national capacity and getting better at implementing this article. The next slide, please. The guidelines are based on a series of underlying considerations, and as we know, evidence shows that there is no safe level of tobacco use. Because tobacco and especially nicotine are highly addictive, and the use and exposure to second-hand smoke has negative impact on health, economic, and environmental and social aspects. This fact and the benefits that cessation needs to be widely communicated to the population is highlighted in the guidelines. Also, the treatment of tobacco dependence needs to be implemented not alone, but in synergy with other existing tobacco control measures under the FCTC, and this will impact definitely how the results on public health will come out. The support for tobacco users to quit and their treatment reinforces tobacco control policies, and this increases the social support and acceptability of the measures. Scientific evidence shows that tobacco dependence treatment is effective and also cost effective for the healthcare system. Tobacco dependence treatment also should be widely available and accessible and affordable, and hand in hand with education to the population, as Article 12 of the Convention indicates on how this can be used and promote cessation. And the strategies for cessation should be inclusive at all levels, considering issues such as gender, culture, religion, age, and educational and socioeconomic status, among others. Next slide, please. The monitoring, next one. Monitoring and evaluation, as in every intervention, is crucial to implement and improve these tobacco cessation programs. The role of civil society is highly highlighted in the guidelines and also in the FCTC itself. So it's essential that they collaborate with the governments to implement the guidelines effectively. Any strategy that is implemented on this article should be protected from the commercial and other vested interests of the tobacco industry in line with Article 5.3 of the FCTC and its guidelines. Guidelines for Article 14 also indicate how important, again, is sharing experiences between parties and collaborate with other partners that may be supporting these initiatives in national level. And finally, it is emphasized the importance to strengthen existing healthcare systems. So we don't need to build something new if possible. We need to use what is in place already in each jurisdiction to promote and implement the best practices on tobacco cessation. Therefore, based on these considerations, the guidelines provide a long list of detailed recommended actions for parties, and these may include conducting national situation analysis, develop a comprehensive guideline for tobacco cessation, and this also considering, again, national circumstances and priorities. But also is very important, as highlighted in the guidelines, addressing tobacco use by healthcare workers, because they are considered as role models by the population. Also building capacity among all the professionals and outside healthcare settings that will provide tobacco cessation and use existing systems and resources to reach the population in need. Among the range of interventions, these are also national treatment guidelines. The guidelines for Article 14 recommend the identification of those who smoke through recording tobacco use in medical notes, providing brief advice for those who need, establish quit lines, and introduce the number in the packages of the tobacco products, face-to-face behavioral support, and the access to free or affordable medications, among other measures. Next slide. On this slide, we're showing some unpublished information. This is coming out from the 2020 reporting cycle, and we will soon publish the 2021 Global Progress Report on implementation of the FCTC with analysis of the data that has been provided by the parties to be submitted to the COP. And here we see again that the average of implementation rates for Article 14 continues to be in what we see middle-low range among all the FCTC articles, and is implemented by roughly over half of the parties. So the situation has unfortunately remained quite unchanged during the previous years, and therefore we see a clear need for scaling up and implementing this article. Parties have also reported that implementing Article 15 was among one of the highest priorities for them to advance in tobacco control. So again, we see that they need support and they want to improve the situation on implementing this article. We also saw that, just to give you more information, over half of the parties report facilitating accessibility and affordability of products for treating tobacco dependence, and majority of them provide what we call the nicotine replacement therapies, medications and other products that are legally available in these countries, and over half of these parties mentioned that they cover the costs fully or partially. So this is important to incorporate these kind of resources and to introduce NRTs in the essential medicines list at national level, so that we ensure that the patients that need them have adequate access. Next slide. So at the Secretariat, we continue developing as much as we can tools and materials that will support as we see the need on parties to implement Article 14. We have published reports with good practices among parties, but also a tool to guide the implementation of a tobacco cessation strategy in people living with HIV and TB. And also we have the collaboration of the WHO CTCA Knowledge Hub on international cooperation based in Uruguay, and they're ready to support parties on the implementation of Article 14 with a set of experts in this article, among others. But we also have other knowledge hubs on specific tobacco products, so those who need specific advice on, for example, smokeless tobacco and water pipes, who have the knowledge hubs based in India and Lebanon, respectively, and they're ready to assist also to implement cessation strategies focused on these products. Next slide. We have, again, evidence showing how specifically behavioral support and medication are effective and cost-effective interventions, but not only separate, but when they're combined. So this is what we recommend to parties to implement, to start as a basic package for cessation support. And also we know that WHO has developed and supports actively parties on the establishment of other series of novel initiatives, including the use of media. And for this, they have measures such as text messages support, mobile applications implemented in the countries, and lately they just have launched Florence, which is the digital health worker supporting those that want to quit in this endeavor. Next slide. As we know, cessation is associated with health benefits, and this takes at all levels, in all groups, in all sexes. So those who commit to quit, they should know that beneficial health changes will be seen very soon down the line, and therefore the message is that it's never too late to quit. We have extracted this information from WHO, and there's evidence showing down the line how this changes and how the health is recovered little by little. On the next slide, we see more changes and recovering the level of health that the smoker used to have. But not only the smoker, we also know that these benefits are also for those that have never smoked and that they are exposed to tobacco smoke. So it's for everyone, is a win-win situation, and also for the environment, because we avoid many other issues coming from the tobacco consumption. Next slide, please. COVID-19 has made millions of tobacco users wanting to quit. So using this opportunity, WHO is leading the 2021 World No Tobacco Day this year, and is focused on encouraging those that want to quit to commit today. So we're supporting this campaign, and it's also a winning situation for all, because not only for those that quit, but for the whole society and the whole environment, the negative impacts that I mentioned earlier. So we need to denormalize the use of tobacco products, and this will make us all winners. And those that want to quit, the WHO campaign has also a pledge to sign, so we encourage you to sign today. Next slide, please. So again, as we know, the situation is very complicated nowadays, and there has never been a better time to stop tobacco use. So parties need to take advantage of the situation, prioritize their capacity, and strengthen their support to those that want to quit. And then for us, I think the message is that it's time to drastically reduce and stop the deaths that are caused by tobacco use. We encourage all of those that are struggled to get in touch with the governments, to get in touch with all those that we can provide technical assistance, and we're here to help in this endeavor. So thank you all very much. Thank you very much for your attention, and back to Fatou to moderate. Thank you.
Thank you so much, Mrs. Lopez. This was really informative, and I think it is a really good way to start this webinar as you give the basic and needed information to even start the process of implementing Article 14 and understanding its guidelines and the measures. I believe that you also touched on the fact that, you know, we often say that, you know, tobacco is one of the leading cause of death. It kills up to 8 million people, but we don't often discuss the cessation part of it. And as you said, you know, in lieu of World No Tobacco Day, and with the theme being cessation this year, I believe that there's a lot that can be discussed and a lot that can be strategized about in order to sort of answer some of these questions that have been raised. I think for me, what I've gathered is the importance of parties having to strengthen their capacity, having to also support those that want to quit, to be inclusive, to make sure that they're not marginalized, because I think oftentimes they feel marginalized, and to encourage them. I think we've also understood the importance of including tobacco control in development agendas. I think that's very much important, as well as partnering with civil society organizations. That really this is, you know, something that has to be done with all the different sort of organizations or the different parties that need to come together and also learn from each other. I would have I have a question. As you stated in your poll, that most parties tend to shy away from implementing Article 14 when it comes to cessation, or that it stayed in the half, that it didn't really go up, maybe from the poll you did a couple of years ago. Would you have an idea as to maybe why most parties shy away from this? And is this something that is also mostly large in low and middle income countries?
Yeah, I believe so. We haven't done the analysis to go deeper into regions because that's not the mandate, but this could be done. We have all the information, what we call the implementation database, CTCA. I will type maybe the website later. This is linked to our main website of the Commercial Secretariat. On the reasons, and I think we have seen in the past years that maybe there's misunderstanding, and parties understand that to implement this article they need a lot of resources, which is not the case for the initial phase, because there's a set, but already the guidelines, even though they are from 2010, there's a set of recommendations that are very affordable and even for free if they can be implemented, but it just takes prioritization. So we need parties to take this on board, to put in the agenda tobacco control and put up as a priority to support tobacco cessation and the treatment on this dependence. So after we have this political declaration to support this recommendation, we have initiatives such as strengthening the capacity that is already in place. So we don't need at the beginning to create new systems, but use what is existing in the country already. Use those infrastructures in the healthcare, build capacity on the health quarters, health workers, which are the main entrance for tobacco cessation, to identify the smokers in all levels of the healthcare system, to provide brief advice. So we need to build capacity on these health workers and other professionals input in the curricula, how to provide this brief advice. So we don't need just more than a few minutes in every consultation with any patient to identify whether they are smokers and whether they're ready to quit smoking. And then if they want to advance, we have all the measures, and they need to pull efforts to get and incorporate, as I mentioned, these nicotine replacement therapies in their list of essential medicines, so that they can get this at affordable or even free prices, for the patients that need it. So we have it's a stepwise process for them to implement. So first of all, we need the leadership of the government, and then the support is there. So we're ready to support and guide them on how to better implement the guidelines and see how others have done, because we have other examples and ready to learn from other experiences. So this is my comment. Thank you.
Exactly. Thank you. That's really helpful. As you stated, there's no need to reinvent the wheel as it already exists. And that there are other resources available, and there's already a guideline in place, and that people just need to be able to go ahead and use the resources that are put in place with them, and also sort of demystify the idea that you need a lot of resources to get started on implementing Article 14. I think that also one of the things that was stated that is very important, if I just look at my notes again, is the fact that there is the need to sort of have the right resources put in place, sort of have toll-free quick lines that need to be put in place, mobile application, online applications. Maybe if certain resources aren't available, to sort of go within the population, sort of provide those resources in order to answer to this demand, because people do want to quit but maybe don't know where to go to quit. So I do like also the tagline, winners are quitters. For us here at ATCA and the rest of the partners, we said, yes, we commit to quit. Yes, we quit. So, it's very, as you stated, the inclusion is needed, and that it is inclusive. So I thank you so much for this wonderful presentation. I just want to remind everyone, if you have questions, make sure to ask your question in the Q&A box. Those questions in French will be answered at the end of the presentations. I will go ahead and introduce our next speaker, Professor Rees from the Center for Global Tobacco Control, Department of Social and Behavioral Science at the Harvard School of Public Health, who will present on how the tobacco industry has used the harm reduction narrative to interrupt cessation opportunities. To you, Dr.
Thank you, Fatou. I wonder if I could share my screen. I think that would just make the talk move a little more quickly, and I will be a bit more efficient. Is that okay, Fatou? Thank you. I just want to say thank you, first of all, to ATCA for hosting the webinar, for kindly inviting me to share some of my thoughts on the issue of the way the tobacco industry has interrupted cessation opportunities through the proliferation of alternative nicotine delivery products. I also want to acknowledge the incredible work of tobacco control advocates across the continent of Africa, and the achievements that they've made in the past number of years. As I think we are all familiar, this of course the data from the United States. We've seen also enormous gains in the US through the implementation of evidence-informed tobacco control strategies. And around the time of the issuing of the first Surgeon General's report, we've seen a fairly consistent decline in smoking, representing a reduction in the demand for combustible tobacco products. And of course, as Letitia just explained, WHO has advanced a number of important initiatives summarized here under the Empower mechanism. And central to this package of strategies is offering people the opportunity to quit using tobacco products through evidence-based medications and behavioral interventions. We also know that most smokers, about 70% of smokers in the United States, and I suspect that these numbers are reflected largely around the world, would like to quit. By 2016, almost 60% of smokers who had ever smoked had quit. And I've just summarized here in this box a number of state-of-the-art cessation resources that have been made available to smokers to support these objectives. Yet we also know that the vast majority of smokers do not succeed in quitting, at least within the first few attempts. We have a number of first-line cessation medications, including nicotine replacement therapies that are considered safe and effective, which are most effective when delivered with behavioural counselling. There are concerns, though, that these interventions don't deliver the sorts of impacts or outcomes that we would hope for. The typical 12-month cessation rates for Nicorette gum and patches is somewhere in the range of 10 to 12%. Some colleagues and myself very recently, and this is a paper in press this month in Preventive Medicine, undertook further analyses of randomized controlled trials of the use of smoking cessation medications. And this graph summarizes the finding, even under very optimistic scenarios of a 20% quit rate that involve behavioral counseling. The overall impact, at least from a US perspective, is that the use of first-line cessation medications might only reduce the impact on the prevalence of smoking at a population level by somewhere in the order of 1%. And when we look at data available to us, again from a US perspective, that reflect the reality of the situation, something like an 11% quit rate, the likely impact at a population level is less than 0.5%, suggesting that we need to continue to refine and develop newer and better resources. But the tobacco manufacturers have exploited this situation. As demand for combustible cigarettes decreases, because of many of the strategies that have been put in place through WHO-endorsed tobacco control interventions, reducing the social acceptability of smoking, communicating the health risks of smoking, promoting cessation opportunities, the tobacco manufacturers have met the decreasing demand for combustible tobacco products with new generations of non-combusted tobacco products, which in many cases have made implicit claims for cessation. They attempt to address consumers' concerns about the potential health risks of smoking by presenting or providing products that promise to lower their risk of exposure to a number of tobacco-related toxicants. They also get a presumed benefit of the notion of corporate social responsibility. These companies are trying to remake themselves or present themselves as being socially responsible, providing alternatives to individuals to benefit their health and the public health. Really, these strategies are part of a systematic plan to maintain market share and continue to protect their profits. And I think people are familiar with the sorts of reduced exposure products that are available in the United States. There is a mechanism through the Food and Drug Administration to allow the marketing approval for products that have been demonstrated to reduce risk as to be marketed as modified risk tobacco products. The European Union has a similar mechanism to allow regulation of these products. And we've seen the proliferation in the past decade or so of e-cigarettes or electronic nicotine delivery systems, heated tobacco products, and smokeless, pouched smokeless tobacco products that are referred to as snus. And I want to discuss briefly each of these in turn this morning. And these are some of the products that we've seen that tobacco manufacturers, combusted cigarette manufacturers have developed and are marketing currently. We've seen Juul and Vuse, the two e-cigarette products, Heat Sticks, IQOS from PMI, and of course, Camel Snus Taxi and Lift are some examples of snus products. The problem with these alternative nicotine or tobacco products is that the tobacco manufacturers have used the harm reduction narrative to subvert cessation opportunities. And the major problem with this is the phenomenon of dual use. That is the combination of continuing to smoke combustible cigarettes while also adopting or supplementing that use with the alternative tobacco product. And one problem and this is driven by the idea of abuse liability. Products with low abuse liability are actually less likely to promote dependence. But that's actually a problem because it's difficult for smokers to switch completely to those products. And what happens is they continue to smoke while using the product when it's more socially acceptable, when it's more physically convenient, and with an ostensible goal of potentially reducing risk. However, dual use yields no net health advantage. As long as people continue to smoke the combustible cigarette, there is no benefit. And this chart here demonstrates the phenomenon of nicotine pharmacokinetics. When an individual smokes a cigarette, they receive a rapid spike in plasma nicotine levels, which disappear relatively quickly until the next cigarette is smoked. And that rapid onset of the nicotine effect and the high spike in plasma nicotine level is intensely rewarding to smokers. And it's that phenomenon, that the way in which nicotine is delivered quickly and effectively to the brain through an inhalational method that makes combusted tobacco cigarettes so addictive, because they are very rewarding in a psychological sense to consumers. And there's problems compounded by marketing. Manufacturers market these products, these alternative products, not to adult smokers, but we've seen evidence. Of course, Juul is a particular case in point of marketing these alternative products to young people who may not otherwise have used nicotine products and in most cases are not currently smokers. So let me touch on each of the three main products before I wrap up. E-cigarettes, of course, we're familiar with, have generated much attention among young people as a novel device. No smoke, limited emissions, they're easy to use, they've become very quickly more socially acceptable, they're very cool. They may be somewhat less expensive than combusted cigarettes, particularly over the long time in terms of nicotine. And we've also seen strong evidence that shows that when people switch completely to e-cigarettes, that they offer the potential to reduce people's exposure to a vast number of the toxicants and the carcinogens that would be present in combustible tobacco cigarettes. Now, the key here is complete switching. People need to switch completely to these products to experience the reduction in exposure. However, we've seen from, particularly from early evidence from early generations of e-cigarettes, that they don't produce or they don't deliver nicotine in the way that a conventional cigarette would. This blue bar on the side here represents the blood plasma nicotine level of a conventional combusted cigarette. The other lines are various different e-cigarette brands or prototypes. And as you can see, even in the case here of this red curve, it reaches a high level, but it takes some time to get there. And this slow rise in plasma nicotine level is not as profoundly rewarding, which in other cases, the blood plasma nicotine levels remain low, which makes it difficult for smokers to switch to these products because they don't deliver the nicotine that smokers are looking for. We published a summary of the use of pod-based electronic cigarettes in JAMA Pediatrics last year, summarizing some of these findings, which included the fact that some of the more recent e-cigarettes have actually high abuse liability, which may support more complete switching. But of course, there are concerns about addiction when that comes to the use of these products or the marketing of these products for young people. They do indeed reduce exposure to a number of toxicants, but there's insufficient public knowledge about these products and the way they function. The US Surgeon General concluded recently with regard to the use of e-cigarettes for smoking cessation that the evidence is not sufficient yet to conclude that e-cigarettes are an effective device for smoking cessation. There's a potential for these products, if properly designed, to support those efforts, but we have not reached that point yet. Heated tobacco products, and we've seen in particular the proliferation of IQOS in a number of markets globally, ICOS also, Philip Morris International have presented evidence, and independent investigators have shown that ICOS also can reduce exposure to a number of toxic constituents, but the nicotine levels in ICOS are substantially lower than a conventional cigarette. And this chart is from Philip Morris's own data showing, and we'll just focus on the bar on the left-hand side here in the United States. Among almost 1,000 consumers who used ICOS, more than half, 63%, predominantly continued to smoke a cigarette, and another 22 or 3% combined use of smoking and cigarettes, meaning that more than 80% of people continued to smoke. Which means that the potential for ICOS to reduce people's exposure to toxic constituents is very limited because there is not complete switching that we require for these products to reduce exposure. Dual use with combusted cigarettes is the predominant pattern of ICOS use. Snus, again, we see this problem with snus, the pouched, pasteurized, smokeless tobacco product, which has been more prevalently used in Scandinavian countries in recent years, have now been marketed by cigarette manufacturers. We did an analysis of snus products marketed in the United States and compared them with the Swedish products that have in large parts supplanted or replaced smoking among a large number of consumers. We found that relative to the Swedish products, US products had high nicotine, but in terms of unionized nicotine or free nicotine, American snus had very low overall levels of unionized or free nicotine, meaning that the nicotine that reaches the brain more quickly is at such a low level in the US product that it's unlikely to support smokers who wish to make the switch. And they do that. The manufacturers, we believe, is intentional because they lower. It's slightly technical, but they keep the moisture levels and the pH levels low, which means that free nicotine is much lower in these products. And the result is, again, dual use. Smokers who switched or who adopt these products continue to smoke. So in summary, where to from here? We think that tobacco manufacturers will continue to expand their product base, targeting different populations with newly designed products. We need product regulatory standards to regulate the performance and toxicity of low exposure products, to clean up these products completely, to reduce the appeal and addictiveness of combusted cigarettes. There are regulatory strategies that we can employ to make combusted tobacco cigarettes even less desirable, and shift people's use of these vastly more toxic products to those products that might be less toxic. But we have particular concern about the way these products are being proliferating or being targeted in developing countries and emerging tobacco markets. So the question is the tobacco end game. Of course, we're focused on the elimination of combustible cigarettes. There are questions that we might ask. We will focus on the eventual elimination of nicotine delivery devices. In the meantime, can properly regulated low-risk nicotine products provide alternatives to smokers, but if they are properly regulated and not allow the industry to dictate the way in which these products are proliferated. So I shall stop there and thank you for your time this morning.
Thank you so much, Dr. Rees. This was very important, understanding how the tobacco industry is able to interrupt cessation opportunities, especially for low and middle income countries who are definitely more at risk when it comes to the tobacco industry. I believe that it was also a good thing, the fact that you brought back the empower mechanisms, the importance of offering people the opportunity to quit, also using evidence-based science products and such. I think that it was also good to understand that even though the vast majority of smokers want to quit, they don't necessarily succeed in quitting. And also that trying to use the two, whether it's the traditional way and also using combustible products, does not help you be able to quit faster or actually be able to quit at all. I believe that for me, what is important was that understanding also the fact that the tobacco industry will expand their products. And the fact that they also will use a certain narrative to make themselves look better to the public eye, whether it is the fact that they're trying to say that they're being socially responsible, whether it is that they're providing alternatives in order to help people quit smoking. My question for you would be then, would you say because of the fact that tobacco manufacturers have used the harm reduction narrative to subvert cessation, would you say that there is a rise of e-cigarette use within teens? Because as we saw in your presentation, it shows that they're mostly geared towards attracting younger smokers, towards attracting teens and the younger population. Would you say that it's a marketing scheme? What would you say in regards to that?
Very good question. There's no question that tobacco manufacturers have targeted teens because the demand for combusted cigarettes in that group is at a historic low. At least in a number of developing countries, including the United States. And so tobacco manufacturers, of course, have moved to develop products that are more appealing to teens, that address the concerns that have developed over time around the health risks of smoking and the fact that smoking is far less socially acceptable than it was perhaps a generation previously. So rather than providing a cessation resource or opportunity, tobacco manufacturers are continuing to create new markets and by addicting a new generation of young consumers.
Okay. Thank you for that. We also received a question from Andrea, who says, so is the hope that e-cigarettes, HTPs and snus mimic the nicotine spike seen in combustible cigarettes to encourage complete switching? But as you also said, wouldn't that present other health challenges?
That's the challenge that we need to understand with better developed science. But for people to have the opportunity to switch completely, we need to deliver nicotine more completely. So either we remove nicotine completely from these products, or we deliver nicotine in a way that's comparable to a combusted cigarette to allow people to make the switch completely to a reduced exposure product. Of course, that needs tight regulation, and that needs extremely clear communication to consumers about the potential risks of making that switch.
Okay, that's a good one. And we had one more question coming from Molly, which says, do you think that the tobacco substitutes, although not containing too much nicotine, are effective in fighting youth smoking, in fighting?
No. Based on the evidence that I shared this morning, products with low levels of nicotine are really very problematic. And particularly when they're appealing to youth, it really provides an entry product for youth to initiate tobacco dependence. And I have concerns about the trajectory of tobacco product use among that population.
Mm-hmm. Okay, so I believe that, one of the important things to also take away, as you just stated, is that whether it's high in nicotine or low in nicotine, it doesn't help. And that when discussing, especially amongst the youth, that this does not particularly help them in being able to quit smoking.
That's an extremely important point. We want to keep these products out of the hands of youth with tight regulations and clear communication. Absolutely.
Exactly. And as you just reminded us, the importance, of course, having product regulatory standards, as you just stated, that are, and to ensure that the narrative is not being controlled by the tobacco industry. I think that as well is very important. I think that within the African context, we see it more than often, especially when we saw the rise of shisha products, with teens believing that they're more socially acceptable and also they're less harmful than cigarettes, when it was the contrary, and it was the absolute opposite of it all. And I think that goes back to, as you said, the regulatory standards. It goes back to making sure that the narrative is not controlled by the tobacco industry, and also making sure that the right messages are being pushed out to the public in regards to these new products and these alternative products, and make sure that it's also based again on evidence.
Absolutely. Thank you. I agree.
Thank you. Thank you so much, Dr. Rees, for your presentation. Thank you for being with us here today. And we will now move on to Professor McKay, who is the Special Advisor on WHO's FCTC Article 5.3, implementation at the Global Center for Good Governance in Tobacco Control, and Senior Policy Advisor to the World Health Organization. She will present on undermining cessation. New tobacco products are not the answer to cessation, especially in low and middle income countries. Thank you so much, Professor McKay.
Thank you, Fatou, for that very nice introduction. As you're putting my slides up, I would just like to say how nice it is to see Yusuf Saluti on this call, because he, like me, has been working in tobacco control for about 40 years now. And although he has worked in Africa, in South Africa, whereas my work has been in Asia, we both find that our problems are very similar. The product is the same, the challenges are the same, what needs to be done is the same. It's remarkably similar across the world, some of the problems that we face. So good evening, Yusuf. May I have my first slide, please? And a full screen. Thank you. So my talk is new tobacco products are not the answer to cessation. The next slide, please. The interesting thing is that traditionally the tobacco industry has not opposed cessation very much. They have certainly over the last half century put enormous efforts into opposing tobacco control legislation and particularly taxation. And yet up to now they have done very little to oppose cessation. And there are several reasons for this historical absence from the issue. Next, please. Firstly, they would have to admit that cigarettes and tobacco are addictive. The industry would have to address the 1994 record of all the tobacco industry's executives swearing under oath that nicotine is not addictive, even though as early as 1962, they knew that nicotine was addictive. And the industry's denial attempts to shift the responsibility for smoking or quitting onto smokers themselves. And I think it very cruelly ignores the real struggle that many addicted smokers, their own customers, experience in quitting. So the bottom line is that tobacco is addictive. And the evidence-based WHO FCTC, now adopted by 182 governments, states this many times. And in fact, an entire article, as we know, Article 14, is devoted to help smokers quit. Next, please. The second reason is that they would also have to admit liability. The industry wants to ignore calls for the tobacco companies to compensate for all the damage that they are caused by tobacco, and also to fund tobacco control, including cessation programs. And this is based on the polluter pays principle. You cause the problem, you pay for the damage caused. Some public health organizations and governments around the world, in fact, are already pursuing this particular approach. But the industry does not want to see this Pandora's box opened up, as it could lead to massive costs for healthcare, millions of premature annual deaths, and so on. But as might be expected, fighting the tobacco industry, these cases are bogged down with years of legal challenges and expenses. And even these ones suing for healthcare costs do not begin to address the economic and environmental costs, such as fires, litter, pollution of oceans by discarded cigarette ends, and lost productivity. Next, please. And the third reason is that cessation is basically the caring face of tobacco control. The industry has been reluctant to criticize cessation programs because of this. So much that we do in tobacco control is framed about laws and taxation that some people very wrongly feel are rather punitive towards smokers. Of course, we know on this call that all of these laws and taxes are designed to help and protect smokers and non-smokers alike. But cessation illustrates authorities directly helping smokers overcome an expensive, dirty and dangerous addiction, which most of them would prefer to quit. So it's a very soft face of tobacco control, and the industry has been rather reluctant to interfere with that up to now. Next, please. But in 2021, with World No Tobacco Day on Cessation coming up, the industry has adopted very clearly some new tactics, and they've changed the tactics this year on cessation with the new theme of commit to quit, because it is using, right around the world, it is using World No Tobacco Day to promote its so-called harm reduction with e-cigarettes and the heated tobacco products. And the industry claims, quote, that these harm reduction products, including snus, e-cigarettes and heated tobacco products, are more effective means of quitting than the use of NRTs, nicotine replacement therapy, and substantially lower exposure to harmful products of combustion seen in cigarettes and bidis. That is their quote. So in other words, really for almost the first time in history, they are stepping forward and actually intervening with this whole area of cessation. Next, please. So what are these novel and emerging nicotine and tobacco products? There's all these N's and E's and T's and P's. It's N's, which are electronic nicotine delivery systems. There's the non-nicotine delivery systems. There's heated tobacco products. But the bottom line is that all of these products are basically now owned by the tobacco industry. They own most of the recognizable brands. This is not a separate issue or industry from the one that we have been used to dealing with. And they are now coming and dominating, even in China now, the National Tobacco Corporation is clearly going to be in charge of e-cigarettes. So the industry as we know it is now involved with an add-on, and these are all these new products. Next, please. The key players are basically the same people we know only too well: British American Tobacco, Imperial, Japan Tobacco, and Philip Morris. And they've got all these various brands in N's, in heated tobacco products brands. They're branding them with these descriptions of a better tomorrow, rethink tobacco, unsmoke your world, hold my light, mission winnow. All of these very catchy attempts to captivate the cessation ground. Next, please. Next, please. But WHO has a very different view. The 2020 Expert Committee on Tobacco Product Regulation has highlighted the addictive potential of these new products. It's recommended taking measures against e-cigarettes and heated tobacco products. It recognizes HTP as tobacco products and harmful to health, undoubtedly unsafe, and states that HTP expose users to toxic emissions similar to those found in cigarette smoke, many of which can cause cancer. And some of these products have their own harm, quite distinct from the harm that we know of previous tobacco products. A recent Stanford University study found that adolescent vapers were 5 to 7 times more likely to catch COVID. They're blowing out all the smoke into the far distance and spreading it much more. Next, please. There are new products, and these products have many, many other problems. And a lot of these, as we've heard from our previous speaker, Professor Rees, are basically unknown. The ingredients, unknown, they're varied. They seem to be a gateway for youth to move on to smoking combustible cigarettes. They also renormalize tobacco use, just as smoking prevalence is beginning to fall around the world, even in the low and middle income countries, they renormalize it. And I have to remind everybody that the tobacco industry has a long history, has previously misled smokers by claiming filters were safer, by claiming low tar cigarettes were safer, and yet these predictions turned out to be untrue. So this is the third time in history that we have been presented with claims that we have the answer and that this is a safer product. And certainly in low and middle income countries, which is where I mainly work, it creates a double burden because many of these countries are struggling to reduce the combustible tobacco epidemic. And this is why more than 40 countries and jurisdictions have now banned completely e-cigarettes. There are some countries in the world like the US and England that are following a very different track, allowing them on the market, allowing them to advertise. But many countries have real concerns that if these products get on the market, then we've got a lose-lose situation because of fighting two epidemics at the same time. And that one of the big problems is, and particularly in the US, that these problems are accompanied by appalling advertising, promotion and sponsorship. And although they always talk about using these products for cessation, their advertisements are clearly aimed at youth to recruit new smokers and not at middle-aged smokers wanting to quit, as the industry claims. Next, please. And I'll just show one slide of some of the kind of advertising. Now, to me, this does not look like being aimed at middle-aged smokers who would like to quit smoking and move on to a safer product. These are so clearly aimed at young people and making it trendy and getting them to start. And herein lies my biggest worry. Next, please. The new products finally do not really help smokers quit. There is a lack of evidence that they help smokers quit tobacco products. Instead, as we've heard from Vaughan just recently, they encourage dual use and continuation. Now, WHO has provided more than 100 reasons, 100 positive reasons for quitting, and includes many reasons illustrating the duplicity and lies, I have to say, of the tobacco industry. For example, stating when you buy tobacco, you are financially supporting an industry that exploits farmers and children and peddles sickness and death. That is the stand of World Health Organization. Next, please. I've put in this one extra slide here, just in fact today, because apart from their advertising, their promotion, the way they're presenting e-cigarettes, this is the history of the way the tobacco industry behaves. And those of you who think this slide is a bit extreme, I would just point out that this in fact is a slide from World Health Organization, which is an extremely conservative body and comprised of its member states. But here we go. What do the tobacco industry do? And we are seeing all of these tactics being shifted onto e-cigarettes. They maneuver to hijack the political and legislative process, firstly. Secondly, they exaggerate the economic importance of the industry. Thirdly, they manipulate public opinion to gain the appearance of respectability. Fourthly, they fabricate support through front groups. Fifth, they discredit proven science and economic evidence. And finally, they intimidate governments with litigation or the threat of litigation or trade threats. And we have seen this in every single continent in the world. And this is really what we must anticipate if we are going to allow these products freely on the market. We're going to see a duplication of the way that the tobacco industry has indeed behaved in the past with combustible cigarettes. Next, please. So my key message is that new tobacco products are not the answer to cessation. That's my take-home message. Thank you very much indeed. Thank you.
Thank you so much, Professor McKay. I liked your end message. I think it is very important that especially the two last slides. I believe that that last slide you included was so necessary for people to understand how the tobacco industry uses these different tactics in order to manipulate, whether it's key decision makers, whether it's the public opinion, whether it's in order to push their products further into the market, or the importance, as you said, of the tobacco industry within developing countries, which is always one of the things that is so hard when we're discussing the context of low and middle income countries. As you stated, they always try to make it seem like they're helping the country when in reality that is not the case. And that these are ways, as we've seen throughout these three presentations, that they use in order to push their own narrative forward, and that we need to be ahead of them in order to be able to not just counter, but to be ahead of their own tactics as well. I believe that one of the things that you stated is that it creates a double burden in low and income countries. And I think it's important that you sort of discuss a little bit of more on that, as we know that there are certain countries within the region that grow tobacco. And one of the narrative that is pushed is that this is helping with employment, or that this is helping, and we hear that often, right? Mm-hmm. So I think this would be good to know that that is not the case, one. And with your experience working in low and middle income countries, what are usually some of these narratives, and how would you say would be the best way to counter that so that it is not seen as something positive, and the importance of having maybe, different cessation programs around?
Well, I suppose I would ask a question back, and that is Malawi a wealthy country? Has it benefited from its entire dependence on tobacco? And the answer is it's one of the poorest countries in the world. I mean, the countries in Africa that grow tobacco and are so dependent upon it, they are not the ones who are making the money from it. It's the tobacco industries, the big tobacco companies, who are making the massive billions of profits. It is certainly not the farmers at ground level in Africa. And there has been a very interesting study done in China. Now, China, of course, is the biggest producer of tobacco in the world. 1/3 of all cigarettes smoked in the world are smoked in China. So there's a massive, massive problem in China, which mirrors the problem actually in Africa. And they did a very interesting study getting farmers for 4 years to switch crops. And use the land in different ways. They were not using the land to build roads or buildings, it was farming. It had to be another farming product. So they diversified into quite a number of things. And their income over that 4-year period, to the astonishment of the Chinese authorities, the income went up between 40 to 110%. So in other words, this was a very key message that actually, if you've got good diversification of crops and it's done properly, then in fact, you actually make an awful lot more money by growing other crops than tobacco. This is not the panacea. It's not a gift to the tobacco farmers in any sense of the word at all. They are exploited, they are poor. As I said, it's the tobacco companies that make the money. And I think we must put a huge amount more effort into the FCTC clauses and articles that talk about crop diversification. Many countries are trying it in a sort of pilot way, but that's the way to go. And the third thing I would say is, however, they need not worry about loss of income, because although the prevalence rates around the world are beginning to come down, population of the world is going to increase phenomenally up to 2040 and 2050. So even if prevalence comes down, the numbers of people, the number of smokers in the world is going to go up for the next 20, 30 years. There'll be more tobacco smoked in 2040 than there is today. So the farmers need not worry about a sort of loss of their product or a loss of income at all. Although the tobacco industry would get you believe that if you passed a law or if you increase the tax and suddenly all the farmers are going to be out of work. That is simply not true.
Exactly. No, it goes back to what you also stated earlier in your presentation, which are the different taxes that are used by the industry. And it's just in the same way that even for the World No Tobacco Day theme, they found a way to switch that around and to promote their reduction products, harm reduction products, which isn't, as you stated, we've seen within the WHO that highlights that these are addictive products still. They're still dangerous, and recommends against them at all costs. So that is very important. At this point, because we're getting now a lot of questions coming in, and then to stay within the time, I will invite all three speakers back to, I mean, it's not a podium, but back to the Zoom, put back your video, exactly, and back to the podium. So I'll start, maybe I'll go back up and I'll start with Dr. Rees. There was a question from Ludgar who says, how do you compare the uptake rate of new products to conventional cigarettes in youth?
Well, I think it depends on the population that you're looking at. In the United States, for example, in very recent years, we saw a dramatic uptake, rapid uptake in the use of vaping products, e-cigarettes, relative to combustible tobacco cigarettes. In fact, we've seen a continued decline in the rate of uptake of combustible tobacco cigarettes among young people in the United States. Although in the past year that decline may have slowed somewhat, which is certainly a concern. It may be different in other countries, but of course in other countries there are different regulations in place.
Okay, perfect. There is also another question, I guess either Dr. Rees or Professor McKay or even Mrs. Lopez. It says here, how are we going to handle the cases that non-smokers uses some of these methods to start practicing how to smoke? And also stating that they've now seen that the tobacco industry has modernized smoking in the name of shisha, which is now used by youth who are not even smoking, and some are installed in public cases. How can we handle these kinds of issues?
Well, maybe I'll just kick off with that. I often say that I'm going to be working till I'm 100 years old. And when I lecture young people coming into public health, I tell them they will have a job in tobacco control for their entire lives. Because although we are getting on top of this problem to a very large extent, we're certainly nowhere near winning this war yet. And I think that the tobacco industry, it twists, it turns, it introduces new products, it challenges governments, more so than it challenges individuals nowadays. And I think that, you know, this is going to be a very long process. And if you look at the history of public health, nothing really was achieved that quickly. From the diagnosis of a disease to its elimination, say smallpox, 100 years, I think we're in the same long haul as we are with the communicable diseases, in fact, in terms of really trying to get on top of them. And the same is true of all the NCDs and their risk factors. So I think that there is, you know, you've got to be optimistic if you're involved with tobacco control, but you've also got to be realistic, and I think you've got to be fairly robust, and certainly there are very few quick fixes. I think we're all in it for the long term.
I agree with that, although the thought of this global tobacco pandemic continuing for decades to come, of course, like everybody, fills me with horror, because that's going to you know, accompany hundreds of millions of preventable deaths. We need newer technologies, and we need them quickly. That I think is an important challenge for us. Of course, we don't want the tobacco, as Fatou, I think you summed up very eloquently. We don't want the tobacco manufacturers to dictate how that scenario might develop. But again, I come back to the issue of regulation of products. While you know, better regulations are required for alternative tobacco products, we need to continue to exert regulatory strategies on combustible tobacco products. And of course, we've seen some of that being put in place with the elimination of mentholated cigarettes in some markets. With discussion, the reintroduction in the United States, for example, of an advanced notice of proposed rulemaking around the elimination of nicotine or reduction of nicotine in combustible tobacco cigarettes to a point where they may no longer be addictive, and consideration of the elimination of filter ventilation, which is also a design feature which changes people's perception of the risk of smoking, and may make smoking easier because it cools the smoke and makes it easier to inhale. So, you know, these are strategies that should be brought to bear as quickly as possible, while we continue to consider ways in which we can shift people from combusted tobacco products either to no product use, or at the very least to those that offer the lowest conceivable level of risk.
And if I may, well, we have, again, 16 years old treaty that has so much to show you and to guide on the actions to the parties to implement. So it's not that just one article you take and implement. It's a synergistic set of measures that need to be implemented. But tobacco industry evolves, and we need to evolve with them. So new products have come, even though the tactics, as Judith perfectly said, are the same. We need to move ahead of what they come up to continue their market, because it's just a business, so they need to continue making profit at the cost of the health of the population. So we're here on the other side of the field just to counteract these measures and try to go ahead. And again, the FCTC is just a baseline. So parties are encouraged to go beyond and be ahead of the tobacco industry and regulate further and implement measures that go into the benefit of the population, from cessation to other measures. And of course, always taking care of the tobacco industry tactics, because again, they're there to make profit, and we need to avoid that more people is damaging and the environment, and again, many consequences that derive from tobacco products use. So thank you.
I like that.
I would just add, I mean, the most recent tactic of the tobacco industry is quite unbelievable, and that is that it's in the production of about 3 different COVID vaccines at the moment. And again, just trying to work out and challenging that and making sure it doesn't get into COVAX. And very difficult issue, because of course countries are desperate to have these vaccines. Fortunately, they're not on the market at the moment, but the tobacco industry is absolutely playing it to the hilt in terms of their responsibility. They're caring for the world, they're producing these vaccines, they want them to go to low-income countries. I mean, they just present us with one challenge after another.
Absolutely.
Again, to the colleagues to make this public, and I think these kind of open spaces to discuss and make people aware they're really important. So thank you.
Yes, very, very important. And as you stated, they find every and any opportunity to sort of slide in there. We've seen it also even, like you stated, during COVID-19 in the case of Uganda, where they donated a sum of money. They always find ways and tactics to sort of interfere. And then, as you stated also, Mrs. Lopez, the fact that there's a guideline here and that it can be used, and it will differ depending on the country's context, but it is available, and it needs to be used. We have 2 more questions, just to keep us within the time frame, since we started a little bit late. We have a question which states, what are the measures to be taken to control the e-cigarette smoking among low and middle income countries regarding smoking cessation?
Well, the measures that I think are available to countries are regulating the device, either to remove the device from sale, as we've seen in probably a majority of countries that have issued e-cigarette regulations. The alternatives are to require manufacturers to communicate clearly to consumers that the product cannot or does not support cessation when used as the manufacturers intend. And so consumers need to be, in markets where nicotine vaping devices continue to proliferate, consumers must be informed about the potential risks of using those products, which include the potential to be unable to completely quit using combustible tobacco cigarettes.
If I can, Dr. Rees, I think what you stated also ties in with another question, which says, then how do you deal with the tobacco industry position that the novel products are not tobacco products? Would you then suggest separate regulation thereof as normal products or medicinal, as in?
Well, I think the argument is really a fallacy. They are tobacco products. The nicotine, even in, I think there's almost no question that the products contain tobacco, even those that have very low levels of tobacco. The nicotine is derived from tobacco. It's very difficult, I think, or at least very misinformative to construe them to be not tobacco products. And I think the strategy of regulatory agencies globally has been to view them as tobacco products and regulate them in the same or a similar way.
Key takeaway message there. They are tobacco products.
Yes, yes.
That is very important. The other question would be, we've got a question coming directly asking that how do you sort of change a country's context when there's not political will by authorities in regards to, implementing certain articles and in regards to being able to push back towards the tobacco industry?
I would offer, I'm sure Professor McKay has thoughts on this, but I would offer that we need to communicate more effectively and more completely with the public to generate social support for political imperatives. We have science on our side, and I think we can communicate the basis for that science more effectively and more completely to consumers to generate support for more impactful policies.
I think that it's a real David and Goliath situation because the tobacco industry have so many resources at their disposal and so many contacts with governments and so much power and so much influence. And in countries that have tobacco monopolies, and there's still quite a surprising number of those, the tobacco industry is part of the government. So we have very little idea of what goes on behind the scenes in many countries, including China. So I think it's a really difficult, hard slog, and we can stay with the science. We can try and keep, sort of promoting the health side, promoting the economic argument, because certainly in my experience, I mean, back in the 80s, we were using the health argument. And now I don't think there can be many governments in the world who do not subscribe to the fact that smoking is harmful to health and kills you. The tobacco industry very cleverly moved it onto the economic argument. So I think we have to become amateur economists and understand, for example, in many of the African countries, the real economic impact of tobacco on the economy and of smokers and on employers and all of that. So I think that, it's a long, hard slog to try and sort of get it right. There's no quick answer to that. And I think political will is one of the really most difficult things, because if you haven't got political will in a country, it's not very likely that tobacco control is really going to take off or be easy at all. So I think one of the things that has happened, I think two things have happened. One is the FCTC. And, 20, 30 years ago, it was in our dreams having something like the FCTC, an international treaty like the FCTC. It's been one of the most wonderful things in so many ways of giving an international template for what it is to do. And also the reporting system. Countries know what the other countries are doing. I mean, in the early days when I was working in Mongolia and Cambodia and North Korea even, they had very little idea of what was going on in the other countries, and the tobacco industries really exploited that. They would say, well, no other country would think of banning advertising. They can't do that anymore because the FCTC shares all the information. They have the regular meetings, they share the information. There's a sort of collective push, a collective nudge towards improvement. So I think that's really, has been hugely beneficial. And I think secondly, there has been this amalgam of, under the Bloomberg family, of putting together the Stop Project, which is basically exposing the industry, finding out what they're doing, exposing the industry, feeding it to journalists, showing how they're trying to obstruct public health policy at every right, left and center opportunity. And I think that that has also been incredibly helpful, because now we have a central deposition, so to speak, of the kind of industry tactics around the world. So you can see And you can refer, you can say, well, this happened in Ethiopia. This is exactly what they're doing in South Africa, for example. You can develop that sort of collective knowledge and information on the industry. And I personally feel that unless we expose the industry and unless we understand it and expose it, we cannot counter it. And if we can't counter the industry, we will never be successful in tobacco control.
Thank you so much, Professor McKay. I think that you summarized it all very well and said it all. Because we are running out of time, we're definitely coming to an end of this webinar. And I would just like to remind, before just closing, all the participants that there is a survey that will automatically appear on your screen. Please make sure to answer it as you are leaving the call. Also, I think that I won't be long, but very much just a couple of key takeaways, ending with what Professor McKay has just already said, and Mrs. Martinez and Dr. Rees, to say that you already have the FCTC, which is an international treaty, which is amazing, already in place. There is a guidebook, there are guidelines on ways to implement the different articles that people need to follow, parties need to follow, and that there's no need to reinvent the wheel. I think it is important to understand the tactics, the different tactics that the tobacco industry is using in order to be able to push back or counter or to be a couple of steps ahead. The importance of inclusion when we're discussing smokers, when we're discussing cessation, having the right resources, making sure that these resources are available to the public, controlling the narrative, as Dr. Rees said, to make sure that we are able to control the narrative and that it is not the tobacco industry that controls the narrative, and that to have product regulatory standards. I think also one of the key takeaways is that alternative products are just as harmful, and also that that there's may or may not be enough evidence based on depending on what product it is. But I believe that if we continue to follow the guidelines of the WHO, FCTC, that we will not be stirred in the wrong direction. I believe that it is also important to make sure that it is understood that some of these tactics are very much geared towards the youth and low and middle income countries, and to ensure that there's enough knowledge and information out there, as we've discussed, sharing lessons learned, sharing challenges, and ensuring that there's a capacity being built around this article. As we found out in Mrs. Martinez's presentation, it is one that most parties shy away from. So I thank you again. I thank all of our speakers for all of this wonderful and informative information. We will send the presentation to the participants at the end of the call for those that may want it. Do not forget to go ahead and answer the survey. It is very, 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 very important. And I noticed that there are also questions that were left in the Q&A that we will send directly to each speaker. If they have the time to please just send an answer so that we can share with the participant. And would like to thank you again for participating in our Cessation and Tobacco Industry Interference webinar. And thank you to all of the organizers, ATCA, CTCA, FCA, ATIM, Stop. Thank you all for joining us today.